With a few exceptions, only psychiatrists as medical doctors offer biomedical therapies. Psychopharmacology is the study of the effects of drugs on mind and behavior, and this has revolutionized the treatment of people with severe disorders. And biomedical therapies, we're talking about drugs, electroconvulsive, magnetic impulses, psychosurgery, and psychiatrist. Again, psychopharmacology is the study of the effects of drugs on the mind and behavior and has revolutionized the treatment of people with severe disorders. To evaluate the effects of any new drug, researchers use the double-blind procedure, in which half the patients receive the drug while the other half receive a placebo. Because neither staff nor patients know who gets which, this research strategy eliminates bias that results from therapists' and patients' expectations of improvement. And using this approach, several types of drugs have proven effective in treating psychological disorders. Antipsychotic drugs such as chlorpromazine, sold as Thorazine, provide help to people experiencing the positive symptoms of auditory hallucinations and paranoia by dampening their responses to irrelevant stimuli. Newer atypical antipsychotics such as clozapine, sold as Clozaril, help reanimate schizophrenia patients with the negative symptoms of apathy and withdrawal. Long-term use of some of these drugs block dopamine receptors and can produce tardive dyskinesia. That's how you say that. Tardive dyskinesia. Sorry. And this is marked by involuntary movements of facial muscles, tongue, and limbs. Many of the newer antipsychotics have fewer side effects, but they may increase the risk of obesity and diabetes. Anti-anxiety drugs such as Xanax and Ativan depress central nervous system activity, and a new anti-anxiety drug, the antibiotic D-cycloserine, acts upon a receptor that facilitates the extinction of learned fears. And when it's used in combination with other therapy, anti-anxiety drugs can help people learn to cope with frightening stimuli. However, they can produce both psychological and physiological dependence. Antidepressant drugs aim to lift people up, typically by increasing the availability of the neurotransmitters norepinephrine and serotonin. For example, fluoxetine, Prozac, partially blocks the reabsorption and removal of serotonin from the synapses. And so Prozac and its cousins Zoloft and Paxil are called selective serotonin reuptake inhibitors, or SSRIs. They are also increasingly being used to treat anxiety disorders such as OCD. Other dual-action antidepressants work by blocking the reabsorption or breakdown of both norepinephrine and serotonin. Although no less effective, these dual-action drugs have more potential side effects such as dry mouth, weight gain, hypertension, or dizzy spells. Administering them by means of a patch helps reduce these side effects. And although antidepressants influence neurotransmitter activity systems almost immediately, their full psychological effects may take a week or weeks. The delay may occur because increased serotonin seems to promote neurogenesis, and the risk of suicide for those taking these drugs has probably been overestimated. The simple salt lithium is an effective mood stabilizer for those suffering the emotional highs and lows of bipolar disorder, and although lithium significantly lowers the risk of suicide, we do not fully understand how it works.